is anyone really listening? We have over 47 million citizens in this country going without health care coverage. 47 million citizens have zero, and they've been left behind. Why? They don't have the money. They simply don't have the money to be able to afford the impossible costs for health care today. People cannot afford to pay for their pills. They cannot afford to pay their doctor bills or their hospital tests or their cancer treatments. These treatments now are out of their reach. And why? It's simple. They don't have the money. And what kind of nation are we when in my home state of Wisconsin, in Shawano County, 19 out of 20 families filing for bankruptcy recently did so only because they couldn't afford their health care bills. We need a uniquely American solution to this crisis, and we need it now, because my patients and my constituents cannot hold their breath any longer. Mr. Speaker, what kind of nation are we? Let's agree right here and right now that we need to come together in a bipartisan way and help to begin to solve this national disgrace. My constituents are listening tonight, and so are yours. Let's end this national nightmare and guarantee access to affordable care for every citizen. Now, we're very fortunate to have a Democratic majority in the United States today. We're fortunate because we have the S-CHIP bill that will be coming back to the House floor on the 18th of this month. That's 1 week from this Thursday. We're hoping to get enough votes to override President Bush's recent veto of this essential piece of health care legislation. The S-CHIP bill is a state-run program. There have been a great number of misrepresentations about what it really is. And tonight, for a few moments, I'd like to review with you what the S-CHIP bill really is all about. It's a state-run private program. It's aimed and focused at the poorest working families. It will cost $3.50 every day to insure a child. $3.50 per day. Compare that to the millions and millions and billions of dollars we're spending in the sands of Iraq. $3 billion per week, nearly $400 million a day, and $3.50 to guarantee access for a child to see their pediatrician or their family practitioner. What kind of nation are we to say no to that? The eligible people will be those who are in the low-income group. Lower income is 3 times the federal poverty level. People who earn $50,000 or $55,000 a year simply don't have the money to spend on health insurance policies, which are now averaging $12,000 to $14,000 every year. It will cover up to 10.4 to 10.8 million children in our country. But don't take my word for it about health care. These are cards I've received from my constituents in Wisconsin. Joe from Hazelhurst writes, I am more likely to die because I can't afford the medical care needed than I am in the danger of being killed by terrorists. Fix this, please. He's not a child, but he needs our help today. Megan and Eric from Appleton, Wisconsin, quote, we are a young family with 4 kids, 6, 3, and twins age 5 months. Our insurance is out of control. Our family earns about $38,000 a year, and we pay $520 plus each month to have health insurance. Our country needs to make affordable health care a priority. And what about Pat from Green Bay, Wisconsin? Health care issues are critical. We need to develop a plan to help the elderly and the uninsurable. For too long, insurance companies have been allowed to discriminate against citizens. Why? For their own personal and individual corporate profits. For too long, our insurance companies have been able to deny people access to affordable care because of a pre-existing condition. We haven't addressed that yet, but we will and we must. Alan from Green Bay writes, universal health care. I need affordable medical insurance. Rhonda from Sturgeon Bay, Wisconsin. Our middle-class income cannot support the increase in medical premiums, copays, and deductibles. It's done for the middle class. The S-CHIP pill is a great start. It's aimed at ensuring that the children of our nation, those who are most at risk of going without, become healthy once again. What kind of nation are we if we don't care for our own children? Our children, after all, we are dependent on their future. I thank you for listening, and I yield back my time.
Gentleman yields back. Under the